Okay.
It should be a timer on there.
Yes, it is.
Okay. All right. I thought we would do just a quick cranial assessment to show how craniosacral is phenomenal at assessment in a very non-invasive way. This is Blaze, this is Diana's horse here at Debbie's farm in Penryn. So this is what we would call listening station. So we're looking for either the longitudinal wave, especially at the pole, or any single bone. And what I like to do assessment-wise is this lateral wave. So this is flexion, this is extension. So if I come to the head, you can start, I would start here. The main place to assess cranially is this, and I'm not exaggerating the flow here on him. Here comes the extension back. You just tune in, there we go, tune in, and I go into treatment. I don't want to do that right now. His body wants me to put still point here, so I'm just assessing. What I notice is it doesn't want to come up. Literally the cerebral spinal fluid in that pole is not coming up as good as it's going back. Now the lateral wave up here, grab the temporal bone, maxilla. It would look like this if I exaggerate it. Out as this comes up, in, out, and now I'm gonna actually hold on to him. Hold on, buddy. So that does create neural tension sometimes. So the right side is free and easy. The left side, you'll have to just see it from here. This temporal bone is moving. When I get down here, something's dead in the water. The jaw, you would think that the jaw would open this way, but in reality, the jaw attaches to the TMJ up here, and it's moving, the head's moving, so the jaw opens this way. It doesn't open this way. So as I hold the jaw, it opens beautifully on the right, and the left is not moving. So there's something going on. You could say teeth, whatever. So what I would do is I go palpate around the TMJ, and right there is the assessment verification. Now, assessing down, you can just come up and just hold different places. And so where I'm at now, I have motion to the right, less on the left. You can technically just kind of do these main areas like the SI. I can look at the SI this way, longitudinally and laterally. And I have really good motion here. So I'm telling you, from a chiropractic standpoint and bone standpoint, there's not a lot of a problem here. Not that there isn't one, but it can't be significant. Craniosacral will always illuminate dysfunction. Let me get more specific how I would do it. I just come up here and I go, hey Atlas, how's it going? It's moving on the right, not left, not on the right. Boom. I'm palpating to get a reaction to verify. I do it whether or not I'm on video or not. So I'm coming down. I don't have a big problem here. Stay neutral, meaning straight, Blaze. So if you turn, you'll block the rhythm. Hold on. So I'm coming down and I have a stop. This is a very common place, unbelievably common, that will give you a whole list of symptomology. Coming down, and he knows it. That's why he's backing up. Come on, some more. C5 out. Stops. Literally, the rhythm's good. Stop. Let me go to 6. On again. So what's the deal with C5? We'll go into that later. There's a lot of neuro coming down here, but there's phrenic nerve right there. And that's phrenic nerve where it comes out of the dorsal aspect of C5. That's diaphragm. So that tells me he's got a stomach problem right then and there. That he's got a drain problem right there. That he's got a problem with the loin here. And a whole loin issue on this side. So that's a whole nother ballgame. Let me keep going back. So I come up here. Nice. Stop. Make sure he's in his step. So something's stopping about T3, 4, oh. On the right. 5, nothing. 6, nothing. This is subtle, obviously. It's not jumping out. 7, so we have a shoulder strain of some sort right there, right in here, okay? Let me just keep going. I'll come on this side on your thing. We're almost done, bud. So the rhythm stops. stops. And this would be T8, T7, T6, stopped, dysfunction. Guarantee the bone's out, but there's a lot more than that. 7, it wants to come back on, and interestingly enough, 8's on. I would normally suspect that to be off, and that will reflect lung. 9, 10 is off. So that, we can go into what that means. Well, it's probably the vertebra. Yeah, to the right, I get it. But it's also, I'm going to press on the heart issue. This reflects heart. So this is like a piano keyboard. That note is heart, and it's out of tune, if you will. So let me just keep going. Okay, so this is a key one, T12. Mark that one in your brain. That reflects the esophageal hiatus. That is diaphragm and stomach. So I'm going to keep going. Okay, it comes back on back here. Good. Not a lot of organ problems if that's going on. And another place where these rhythms automatically stop. They're telling you what's going on. So again, I'm going to exaggerate the motion this time. I'm on right here now. Stop. So why did it stop here? T18. So let me just see which side. And it doesn't like it either side. So T18 reflects, here's the Chinese version. Acupoint. Stomach on the right. Stomach on the right. That's what it's telling you, and that is that diaphragm issue from here. The stomach sits right here. So the left side of the stomach, osteopathically, I'm going to flinch it, and it's not causing a spasm through the intercostals. The right side of the stomach, there it is. This is all about the right diaphragm, right there, and that nerve. So let me just keep going, and then I'll quit. So I don't have any motion here. So there's going to be a lot of compensation for this body to pick this up. This is where the diaphragm attaches to the lumbar spine all the way to L5 on the right. Now it's two muscles, so this is a different issue, but there's the left diaphragm test, no problem. Here's the right diaphragm test.
Oh, geez.
So it's all verified off of that C5. Keep going. When do I get more back on? Okay, SI's right here. L6 doesn't like it, SI's on. So SI is being the hero here, trying to help push everything back up to the head. Sacrum, cranium, cranial, sacral, these guys are working together. So I'm going to just keep going back. So this would be sacrum, not a big problem, weaker on the left. That would mean he would have neurology down here, some but not off. And there it's off. So this is tailbone. Right there's tailbone. So for the hell of it, I'm gonna just ask this tailbone to go home. This is not craniosacral. I could still point this, and it needs to go to the right. Notice it comes to me, it doesn't like the right. And so I'm just gonna put it in some vectors. All right, Blaze, I need you to let go. I'm giving him the feeling to let go of his right hip so we can let it, it's gonna go. One more, Blaze. Now, there it goes. Okay, attaboy. So anyway, this is kind of a longitudinal assessment of the spine, mostly using the lateral flexion and towards the medial extension of this cranial rhythm. It is unbelievably assessment. To leave the last thing, you can go down a leg and you can verify. You can verify with ultrasound, you can verify with radiographs, you can verify with palpation pain, literally down the leg looking for lesions. Now it's not going to tell you if it's bone until you go into bone, or ligament until you go into ligament. So I'm not seeing an issue here. Feet issues, heat issues, abscess issues, suspensory issues. So here I come down a leg, and it's very uncommon not to find some. So he just had his feet changed, angle and shoes. So as I come down, I get a stop, and I want to localize that right there. So if I come on the bone, it's okay. If I go here, it isn't. If I go to the medial side, it's fine. So I've localized something here. That's all we know. So I'm just going to ask him lift right here. So if I go look at the superficial, fine. I look at the deep, no. So this is cranial rhythm. I'm going to exaggerate that. On, off. On. So there's something here, and I guarantee that's at least grade 1. That should palpate. Bliss. We come behind it. Right there on the deep suspensory. So it's obviously not a problem, but right there. that would be like a grade 1. So there's ways to treat that. You can even use the cranial rhythm and ask it to come back on. Be surprised what it takes right there. So I'm asking it to go into flexion. A little bit of pressure, let it go, Blaze. Right there. Believe it or not, that takes a grade tear lesion better. I wouldn't call that a tear. Slight strain. It would take it down almost a whole grade right there. And probably recoup. So anyway, this is a great horse to show cranial assessment.